Hey everybody, so today we are going to look at a recent recall. 15,000 packages of makeup wipes from Neutrogena pulled off the shelves from bacterial contamination. We're going to look at one, why that might have happened. Why did they actually have the recall? How could that happen to a big manufacturer like Kenvue, who owns Neutrogena? And two, could this have been prevented from AI? Great new tool being used in some microbiology labs. Some microbiology labs are not using AI. Could that tool have been used to prevent this recall? So let's get into it. So you might be asking, who am I? My name's Jason Lawhoon. I have over 15 years experience as a quality controlled microbiologist, including managing quality controlled microbiology programs for a Fortune 500 company. So now, disclaimer, I do not work for Neutrogena, owned by Kenvue. So this is a bit of speculation on my part, but I have seen this typical scenario play out before in my experience in the industry. So these makeup wipes were recalled for a microorganism called pluralibacter gergoviae. Okay, and that might sound unfamiliar to even very good QC professionals and microbiologists in the non-sterile manufacturing world because it's not listed in the general guidelines that those people normally have to follow, such as USP 62 for the specified microorganisms, as well as USP 1111, which gives guidelines for recommended specifications for non-sterile OTC drug products. So even though that microorganism, pluralibacter gergoviae, is not listed like the typical Salmonellas, Pseudomonas aeruginosa, E. coli's of the world, Burkholderia capacious, which has been the most recent problematic microorganism that the FDA has been focused on. What even very good QC managers and microbiologists missed is the little section in USP 1111 that says any other microorganisms must be evaluated by the manufacturer. So the FDA doesn't manage your product. There is no list that dictates consumer safety. That is up to the manufacturer to determine if they have microorganisms in their product, if it is a problem. So how does this tie back to the Neutrogena recall? Well, imagine you're a microbiologist doing the testing. You get recovery of this microorganism, pluralibacter gergoviae. Well, what's the next step? So normally, even for large manufacturers, they oftentimes use contract labs, and even in their own labs, they'll have specifications based off the regulatory guidelines. Again, the regulatory guidelines do not mention this microorganism specifically, and surprise, the microbiologist does not have superpowers. So what do they have to do? They have to look it up. They have to research this microorganism in the specific context of the product that it's being manufactured and determine, is this a risk for the consumers of this product? This is the risk-based approach that the FDA is really looking for. So that's the problem, and that's how this recall possibly could have happened. We get this microorganism recovery, microbiologist, maybe at a contract lab, maybe within an internal lab, looks at the recovery, they get a microorganism, they compare it to the compendial guidelines, and they say, it's not there. We're good to go. Let's release this product. But again, the problem is you need a risk-based approach. So the next step is, could AI have helped prevent this?
Hey everybody. Okay, so could this recall have been avoided using simple AI? So I have my Gemini up here. We're going to use deep research. You can use ChatGPT, Claude, anything else. The whole idea is you have to use it in a documented way to meet ALCOA principles, right? Especially if you're going to help this aid in an investigation. So I have my free to download PDF. You just enter your email. You can get access to this PDF all ready to go, which will help cover you in case a regulatory body comes knocking and says, how have you been using AI? Okay, and you can see everything is anonymous. So this scenario is an investigation into an unknown isolate found in Lot X of makeup remover wipes. The organism was later identified as P. gergoviae. Okay, so we are going to take this prompt, acting as a QC microbiologist, evaluate the regulatory risk of finding this organism, formerly Enterobacter gergoviae, right? I'm a microbiologist and I still pronounce it wrong, in an aqueous-based non-sterile makeup remover wipe. Right, so we are going to take this prompt. So it specifically analyzed its resistance profile regarding common preserved systems. Is this organism considered objectionable? For this dosage form, per FDA guidance, cite recent recalls if applicable. All right, so fairly robust prompts there. We'll just put this right into our AI. And we'll take it from fast to thinking. We want it to think as much as possible, give us citations, right, which is one of the things I like about Gemini. The deep research is very good at that. We'll let it run. It's going to give us a research plan. It usually takes about 30 seconds to a minute. Then we will execute that research plan. See, this is for informational purposes only. For medical advice or diagnosis, consult a professional. Or how about just have a human in the loop, right? No matter what you're using this purpose for, have an SOP around it, have it defined, and make sure that the person that's using it is qualified. So we're going to go ahead and review this here. Yes, we're going to look at the FDA guidance. Okay. Start research. We'll go ahead and give this about 5 minutes or so. It's going to put together the plan. It's going to be thinking, starting the research. All right, and then we will come back and see what this gives us that we can put back in our prompt log as the official answer from the AI. And you can see it's very important not to be biased, not to start to put anything, tell me why this is not objectionable, right? So that is one of the first things. All right, and I see the first thing it comes, it poses a problem in cosmetic formulations. All right, so we'll let it finish, and you can see it's already got several references here. And we will come back and see what the ultimate conclusion is. It's not looking good. It's not looking good for your product X makeup wipes. All right. Okay, and we're back. So what did it come up with? Well, if you're Neutrogena, owned by Kenvue, nothing good, right? So within a sterile aqueous-based cosmetic matrix, specifically a makeup remover wipe, this would constitute as a critical quality excursion that necessitates an immediate and comprehensive regulatory response. Okay, this is without any other context. It's just the simple prompt. Okay, this would unequivocally categorize P. gergoviae as an objectionable microorganism. Okay, and this is not listed in USP 1111 as an objectionable organism, but you have to determine as the manufacturer what the particular microorganism in your product, if recovered, could pose to that end consumer. Okay, and they have a very detailed output here. All right, talking about the preservative resistance, how it overcomes the preservative systems. Let's see what else it has. Okay, GMP application. Then it talks about how this, while it's not a specified microorganism, it is objectionable based off the manufacturer, how the manufacturer should evaluate it, right? So, aqueous wipe, it's not good. And then you might say, well, how do I verify all of this information? My goodness, they have a lot of information. And what do you know? They flagged the Neutrogena makeup remover wipe recall, even though we anonymized all of the information. So they're bringing that up. You can see another one from Cottonelle in 2020. So they're pretty good at finding those historic recalls that are very important, right? So you always want to know historically, even though this organism is not a specified microorganism, have we seen it before in a recall? Do we think it's a risk for these non-sterile products, right? These products do not have to be free of microorganisms. So they have various recalls here. And to wrap this up, you can see all of the different references. So why is this helpful? Because now we have to go back and put this output into our form, all right, and do the human verification step. And I've reviewed the AI output and I've cross-referenced it against the following source documents. So you can see this makes it very easy to go ahead copy the entire thing here, pick some of these references, okay, and then go ahead and verify that you have checked. Okay, so Neutrogena, makeup remover wipes, class 2 health risk over bacterial contamination. So they've got the lawsuits going. I don't know if we're going to reference this as one of our references, but you can see here they have several verified websites that discuss the risk factors. So you can go through those, pick the more scholarly ones, but certainly all of them do link to a legitimate case. And sometimes they don't. Sometimes that's why I like to use Gemini. You use something else, or if you do, say, a fast search, you may get something that hallucinates. That's why you do have to go about actually verify those links, right? And then whatever you do decide to use as your verification, you can put those source documents in here. That way you have a very closed loop. You have the AI output, you have the human verification, and then you sign off that I have verified this. I will not release these makeup wipes based off my evaluation using simple AI. And that is how the recall could have been avoided.
Okay, so now we've seen how AI can be used as a tool to evaluate microorganism recovery and really help save a company millions of dollars in a potential recall. So it's the AI that does the research, but it's the human in the loop that does the verification, that signs off, that has the expertise, that can check that AI output and make sure that it's correct. Now, here's a surprise. Your analysts are probably already using AI. Now, you want to make sure those analysts are using AI correctly. Click the link below in my description here, and you can get access to the free PDF I put together. It's really an audit defense kit, we like to call it, because it will protect you in case the FDA or some other regulatory body comes knocking and asks how you are using AI. It will also make sure that your analysts are using AI correctly in a traceable way, in a way that we know that's verified, that they're checking the output, not just copy pasting whatever the AI gives them, which sometimes can be incorrect. So if you're interested in that, click the link below. If not, thank you for watching. And if you're interested in working with me more, I do have an opening for 1 or 2 clients right now. Just get a hold of me, click the link, and I will contact you.